Today, we'll ground our conversation in CHCS First Latino Health Almanac, a foundational analysis developed in partnership with our colleagues at UCSF Latinx Center of Excellence. We will look at the data and then consider strategies and solutions that can help move forward our shared goals for a healthier California. At CHCF, we hold a clear vision. A California where everyone, no matter their background, their language, their country of origin, their immigration status, or their zip code, that everyone has seamless access to high-quality, culturally responsive care. As you'll see from the data in this almanac and from what we hear from our community itself, that vision remains far from reality. Too many families are uninsured, too few have a regular source of care, and there remain persistent shortages of Latino providers who can deliver care that reflects and respects our culture. This conversation is especially urgent. Latinos in California are being targeted, harassed, and intimidated by federal agents and federal policies. The collection of data, the reporting of data, and efforts at achieving progress are systematically being attacked. In California and across the country, the Medicaid program, Medi-Cal as we know it, is slated for deep cuts and onerous new requirements for enrollment are underway. This program, while not perfect, is a lifeline for many Latino families across the state. At CHCF, we approach this work with deep respect for the strength and resilience Latino communities bring, strong family networks, cultural traditions that support well-being and wellness, and an unwavering spirit to forge ahead in the face of our adversity. Our team at CHCF look forward to working in collaboration with you, alongside communities, safety net providers, researchers, and policymakers, to dismantle barriers and to recommit to building a healthcare system that works for everyone. It's now my distinct honor to introduce Dr. Jane Delgado, President and CEO of the National Alliance for Hispanic Health, a premier science-based and community-driven national organization. For decades, Dr. Delgado has been a pioneering voice for improving the health and mental health of Latinos. She's a trusted national leader, a prolific author, including 9 books in both English and Spanish. She represents Latino interests in many governing roles in the public and private sector. I look forward to her insights today. Ladies and gentlemen, please help me welcome my colleague and dear friend, Dr. Jane Delgado. Jane, thank you for joining us today. For those of you who are interested in a more detailed bio, you'll find that in the chat. Take it away, Jane.
Okay. Well, I'm very glad to be here with everyone today, especially because I have lots of information to share. And, one of the things about the national landscape is different is that when I say moving forward together, it means we all have to look forward and move forward, but we're all not going to be doing the same thing. So what are some things that you need to know is, okay, why aren't I moving forward? There we go. My perspective is that I'm going to talk to you about why Hispanic health is important, some of the accuracies that we have to focus on, and how to move forward. With that, you should know the Alliance is actually 2 organizations. One is the Alliance and the other is our foundation. Together, we're about $20 million. The Alliance does all our government work, and the foundation does all our work with non-government entities. And we have some core values that are very important. Our mission since 2015 has been best health for all. And we don't take funding from tobacco, alcohol, sugar-sweetened beverages companies, and we're also a nonpartisan health organization. Being in Washington, D.C., that's very, very rare. And we do research, service, and advocacy throughout the Americas. I want to emphasize that Hispanic health is not new. Back in 1985, you must have heard of the Black and Minority Health Task Force from way back then. Volume 8 was only on Hispanic health issues. And people say, well, Jane, why was it only on, is it called Black and Minority? And the reason it's called Black and Minority, and you'll hear it here from me now, is because it was actually supposed to be the Task Force on Black Infant Mortality. But then the secretary, Margaret Heckler, said, well, people who are Black have other health issues also. And so then they called it Black Health Task Force. And she said, well, how about the other groups? So that's how it got to be called Black and Minority Health Task Force. Also this is the wrong date. It's not 9/24/25. This is actually 1990. This other document was the first public APHA journal that focused on Hispanic health. So we're moved fast forward to the front now, and these are two articles that recently came out, one on New England Journal of Medicine and one on Nature that talk about us as a community and why it's different. And we were very happy in Washington last March when we celebrated that OMB was finally going to talk about race ethnicity, okay? And then what happened? The world changed in June 2024. Many people focus on different events, the elections, all the activities that have been going out throughout the government that has really hurt our communities. But really, this policy change in June by the Supreme Court changed the relationship between government, industry, and people. And I know that everyone here has their own perspective on things. So hearing a little bit of my concerns is part of what is part of my presentation, because I know everyone's saying, oh, well, Hispanics are 42% of the California population. And my concern is, yeah, in 1990, we were 26%. And in 2014, Hispanics were the greatest group, only exceeded by non-Hispanic whites. And also since 2003, in the United States, non-Hispanic whites were the only groups larger than Hispanics. So the question is, why has it taken so long for us to really focus on our issues, to really work together as a community to move things forward? And I think part of it is that when I wrote that article in the New England Journal of Medicine, I had written first in JAMA, and I got a comment back saying, oh, you can't talk about Hispanics. And it's the comments that are written there. Hispanics are diverse and cannot be considered as a group. And all these other comments that were written when they rejected my paper, that was JAMA. My response was, well, most groups are diverse. Asians are diverse. Non-Hispanic whites are diverse. Non-Hispanic Blacks are diverse. We're all diverse. But for many years, people used talking about Hispanic groups being diverse as a way to sort of minimize our size, our numbers, and our strength. We cannot allow that to happen anymore. When some of my members, and we have members from around the country, say, we didn't cross the border crossed us. That is true for people from Puerto Rico, Texas, the Southwest, California, all over. So whose border is it? Okay, moving along to the next issue that I am concerned about is that people say, well, it's all these, we have to understand what's going on now because things are different. No, in January of 24, there was an article in the New England Journal of Medicine that talked about these two studies they did with algorithms in 71 in England and in 76 in Copenhagen. And their finding was that cultural and linguistic differences were very important as to why the algorithms they developed in England did not work in Copenhagen. It wasn't enough to be non-Hispanic white or whatever people called themselves then. You really had to understand the culture. And yet, when you look at what we say, very often we go on old data, which is why the almanac is so important, because it presents what's fresh, what's new, what is today. And I always say accuracy requires humility. Why? Because you have to say when you made a mistake in the past. So that can go from when the Merck manual said these awful things to when recently they did these health grades and found out that they really didn't match up to the experience of whether a hospital was an A, B, C, or D, didn't match up with what people experience if they were Black, Hispanic, on Medicare or Medicaid. So data is something that we know. We know Hispanics live longer, and this has always been controversial. Some people like charts, here it is in a bar graph, but we do live longer. And also, the other thing people don't understand is that mental health is a major issue for our community. And trust me, everything that's going on with immigrants, and people say, oh, the undocumented people who are documented, people who are here, the children, everyone who's seeing what's going on in our communities, this is going to have a major mental health impact on them. And we have to be able to serve people in all these ways. So something that when I was preparing this, I have the slide that talked about the leading cause of death. And up until today, I would always say Hispanics and Asians, cancer is number one, and heart disease is number two. For the Black and the white community, it's just the reverse. When I looked at the latest data, for the first time for Hispanics, number one was diseases of the heart. And if you look at some of the COVID data, you'll see that we got impacted by COVID a lot. And I think it was Nature Medicine in 2022, there was an article talking how COVID increased cardiovascular disease. Our community has been changed by COVID, by all the things that have happened. So moving forward, what are we doing at the Alliance? Multi-pronged. First, we work with our community on weight to click so they can tell a difference between real or synthetic. This is something we did with the Carter Center. We work training women to take control of their health and giving them strategy. It's actually called used to be called Mi Hermana, it's now Mi Hermana, Mi Gente, because the women wanted to include other people in their community, so it's now Mi Gente. We also have fund research, and this is the latest round of research that we're funding at the Alliance. And this is, the policy things that we're concerned about. And they're everything from support health access to expanding substance abuse and mental health services. But what we're just launching and I'm announcing now is a beta for our Action Center on our Healthy Americas Foundation. It's an online resource where anyone for free can either get engaged in voter registration, receive action alerts, they can write to their senators and representatives, comment on federal regs, all sorts of work. This is something new I'm announcing today. It's a beta. We're just doing it because we know that the action is at the state level. That right now, with the changes that we see, we have to be prepared to do things at the state level. And that means giving people the tools so they know what they can do and where they can go. So science has changed everything, all right? Science is changing what we know about medicine, what we know about the microbiome, what we know about the long-term effects of viruses on people. So getting over COVID was good, but the long-term effects, especially in our community that suffered so much from COVID, we're just seeing those impacts now. So look forward. What do I say look forward? Well, look forward means to me 4 things. First, we have rebuild. A lot of people saying, oh, we have to resist. At this point, we have to rebuild. What's gone is gone. We can't look back. We have to look towards the future and how we're going to make that future better for everyone. People talk about social determinants of health. Yes, they used to be called the need for one-stop shopping, and then it was comprehensive care. And now with AI, that's changing everything. So really, when we rebuild, we have to think of where we are now and what are the tools. The second thing is we have to reconnect. I continue my work with President Carter's Carter Center. And one of the things they always say at the end of our meetings is, and remember, because of who you are and what you have a responsibility not just to talk to your friends, but to reach out to someone you would never talk to, because it's important to talk to as many people about the things that are important to each one of us. The next thing is to reconsider, ask questions. You know, people get very focused. And I said, focus is great, but don't get tunnel vision. As we look at data, as we look at how the world has changed, how our community has changed, we need to be there to respond, to serve, to help, to buoy, and sometimes to say no when people want some things that are not helpful. And finally, we have to restructure. This idea, when people would make tables and compare like one community to another and say, well, you know, this is what's going on in the non-Hispanic white community. And our feeling is at the Alliance is we should be, whoever we're looking at, they should be better than the best of the different groups that you're looking at. So if one group has better birth outcomes, well, everyone should be that as good as that group. So we have to think of ourselves as being the leaders in this country, not let other things diminish us or what we can do or where we're going. We have the opportunity now, look forward, rebuild, reconnect, reconstruct, and restructure. Those are the things that I'm hoping that we will all do. And those are the things that at the Alliance and the Healthy Americas Foundation that we are prepared to do with all of you. And I'm stopping my sharing because we've had such wonderful presenters today, and I don't want to take anybody's time, but thank you for the work that everyone out there is doing. If you're listening to us, you're part of the change, and thank you for that.
Thank you so much, Dr. Delgado, for those warm words, for your leadership on Latino health and your call to action during these trying times. We really appreciate you being with us here today and sharing how we can all contribute. Good afternoon, everyone. I'm Diana Camacho. I'm a Senior Program Officer at the California Healthcare Foundation. I work closely with community partners and safety net providers to advance Latino health across California. Next, we are going to transition to sharing the key findings from the Latino Health Almanac. CHCF published the Latino Health Almanac in partnership with UCSF to harness the power of data, especially in a time when data itself is under threat. We really wanted to tell a story about Latino health and spotlight the urgent needs of the community. By grounding the conversation in quantitative evidence, we really aim to contribute to the investment, innovation, and policy change to support Latino health in the long run. With that, I'm delighted to introduce our next speaker, who I've had the pleasure of working with on the Latino Health Almanac for the past year. Please welcome Dr. Alicia Fernandez, a leader of Latino health nationally. Dr. Fernandez is a professor of medicine and director of the Latinx Center of Excellence at the University of California, San Francisco. Take it away, Alicia.
Thank you so very much, Diana. It has indeed been a pleasure to work with you. Thank you all for being here. We are really happy to get to give you a little bit of a taste of the Almanac findings. I'm also particularly happy to be here representing the rest of our UCSF team, including Dr. Janet Kaufman, co-PI of this project, and Lupita Ambris, project director. Our selection of metrics and data sets were informed by advice from community and research advisory boards. We purposefully focused our data as coming from publicly available data sets, and we chose our major comparison to be between Latinos on one side and all non-Latino Californians on the other. When possible, we offer data from subgroups, such as differences between immigrant and US-born Latinos. For more interesting subgroup comparisons, please see the Almanac. We thank the members of our advisory board, some of whom will join us later. They represent important community-based organizations from throughout California. We also thank the members of the Research Advisory Board. They are stellar researchers from throughout the University of California. And with that, let's turn to a quick overview of some of our key findings. In the area of demographics and drivers to health, let me start by reminding everyone that 2/3 of Latinos in California are US born. Of the third that is not US born, the majority are born in Mexico. Latinos are also heterogeneous in in levels of English and Spanish proficiency. About 1/3 of Latinos report speaking only English. Of those who are bilingual, 43 report that they speak English very well. It is important to note, however, that about 15% of Latinos in California report speaking English not well or not at all, something that poses considerable barriers to healthcare access and to the healthcare experience. Educational attainment is similarly varied. While the Latino population as a group has lower educational attainment than non-Latino Californians, we see a degree of diversity. A third of Latinos report that they did not finish high school. If you look at foreign-born Latinos or immigrant Latino population, more than 50% report not having finished high school. On the other end of the scale, you can see that about 15% of Latinos report having a bachelor or a graduate degree. Poverty is common among Latinos. And here we show you that Latino households with children face higher levels of household food insecurity and higher levels of housing instability than non-Latino households. Of note, 1 in 3 Latino households with children reports household food insecurity. Moving then to access to care, we'll start by commenting on health insurance. Both employment-based and Medicaid health insurance are very important sources of payers for both Latinos and non-Latinos. Medicaid is particularly important. 1 of 3 Latinos is insured by Medicaid. In fact, among children, 1 of every 2 Latino children, over 50%, are insured by Medicaid, thus making Medicaid policy Latino health access policy. The numbers of uninsured, while they've gone down significantly in California, remain highest among Latinos, as you can see here with in this breakout graph. We turn to usual source of care, and usual source of care is important because it can improve coordination of care and make it easier for people to access both chronic disease care and acute care. Latinos are a little less likely to get doctor's care in office or at Kaiser, and more likely to get care in community clinics or a community hospital. However, we underscore here that 30% of Latinos report having no usual source of care. The Latino workforce is also important. While there's much more data in the almanac, we'll stress here that Latino physicians are woefully underrepresented for the size of the population. If you look here, what we see is that there are 12.2 Latino physicians, primary care physicians, for 100,000 Latinos, as opposed to 93 physicians for 100,000 non-Latinos. And as you can see, these discrepancies exist throughout all the regions in California. Let's turn then rapidly to physical health. All right, here comes our first major piece of good news. As Dr. Delgado underscored, Latinos historically and even now have lower mortality rates than other major population groups. And here in California, you can see that Latinos, shown here in the red, have lower mortality than either African-American Californians or white Californians. You can also see here how the Latino mortality advantage was temporarily erased during the COVID-19 pandemic in 2020 and 2021. The leading causes of death for Latinos are the same as those for the non-Latinos. However, heart disease and cancer are much less common as causes of death for Latinos than for their non-Latino Californian counterparts. Instead, COVID-19, diabetes, and liver disease play an outsized role in causing death. Diabetes deserves to be underscored here. Diabetes rates are rising. Here is the Latino line in the deep red, going from 9.8 to 14 in 2023. You can see that this rise in the incidence in the prevalence of diabetes is particularly common for foreign-born Latinos. Among U.S.-born Latinos, the lines typically overlap with that of non-Latinos. So large increase in diabetes, ongoing increase in diabetes, particularly among Latino immigrants. And that is partly that there is still a rise in obesity among Latinos, whereas among non-Latinos, the rise over the last 15 years has been much slower and lately has leveled out. We wanted to pull out at least one disease condition to share with you. We're showing you HIV cases. These are new HIV cases. And here, what we wish to note is that HIV is dropping. New cases of HIV is fortunately dropping among all California groups, with the exception of Latinos. Research has shown that this is driven by cases in the immigrant community, where access to care and stigma continue to play important roles. Let's move now to behavioral health. Rates of substance use are similar for Latinos and non-Latinos, with the exception of alcohol. Alcohol intoxication is more common among Latino men than non-Latinos. And this represents here emergency department visits for alcohol intoxication and withdrawal. However, among Latinas, for women, rates of alcohol, acute alcohol intoxication are less than that for their non-Latina counterparts. Death rates from homicide and suicide continue to be important throughout California. The Latino homicide rate is higher than for non-Californians, but the Latino suicide rate is significantly less than for non-Latinos. Depression is fewer Latinos report having ever been diagnosed with depression than non-Latinos. This may be due to one of two things. One, that Latinos may in fact have less depression, though other studies don't really show that, or underdiagnosis of depression due to difficulties accessing care and cultural and linguistic barriers. We'll turn now to reproductive health. This is a very encouraging slide, which shows that adolescent birth rates have fallen dramatically among Californian adolescents, including for Latinos and non-Latinos. However, we note that Latina adolescents still have rates 3 times higher than non-Latinas. At the same time, a sobering note, which is that maternal mortality among Latinas has been rising. Latina maternal mortality is now higher than that of whites, not shown on the screen, though it remains much lower than that of African Americans. This is a true change in Latino health status, as Latinas typically had much lower mortality than other major population groups in California. While Latinas initiate breastfeeding at the same rate as non-Latinos, they are somewhat less likely to still be breastfeeding after 3 months, and significantly less likely to have exclusive breastfeeding at 3 months, as is now the current recommendation. Turning to youth health, we'll start by telling you that Latino children have higher rates of soda consumption than non-Latino groups. Not surprisingly, perhaps, they also have much higher rates, twice the rate of childhood obesity for both children, for children and young people. In short, we are presenting here a rapid overview of the almanac, and we want to stress that Latino health overall remains quite good in many ways, with less mortality than the white or African American populations. That is largely driven by good health among foreign-born Latinos. However, obesity and diabetes rate are threatening that achievement, and it is particularly worrisome among our youth and for pregnancy. So let me stop there and thank you all very much for your attention.
Thank you very much, Dr. Fernandez. I encourage folks to check out the rest of the almanac. Dr. Fernandez just shared some of the slides. There's much more information to see within the almanac, so please check it out. And we also have an interactive data dashboard that looks at regional snapshots of Latino health across the state. I'd also like to mention, in addition to the data we've just reviewed, the teams at UCSF and CHCF collaborated with the group of Latino health experts that Dr. Fernandez mentioned to identify policy priorities that directly respond to these findings. I encourage folks to check those out as well. With that foundation in place, we now turn to our panel discussion, which will focus on the policy environment, exploring the steps we can take together to advance health equity for Latino communities moving forward. Now I'd like to turn to our esteemed panelists. If you could turn your cameras on and go off mute, please. First, we have Mayra Alvarez, who is the president at the Children's Partnership. I'm also delighted to welcome Dr. Cecia Aquino, who is the executive director at the Latino Coalition for a Healthy California. And last but not least, Dr. Arturo Bustamante, who is professor of health policy and management and faculty research director at the Latino Policy and Politics Institute at UCLA. Thank you all for being here. You are all wonderful partners to CHCF, and we're excited to hear your insights. So I'll jump it off with our first question. What do you consider the most important findings from the Latino Health Almanac? And more broadly, what are your overall impressions of how these data reflect the lived experiences and challenges facing Latino communities today? I will start with Arturo, if you want to take us into it.
Yes, thank you, Diana. Thank you very much for the invitation. I really like looking at the findings of this almanac because it portrays very clearly how Latinos, in spite of being the plurality of the state's population, also keep experiencing very wide gaps. Particularly, the almanac points out to very specific areas such as diabetes outcomes, youth obesity, dental and preventive care, access to a usual source of care, and also underrepresentation in the health workforce. Particularly of my interest were, for example, access to care disparities in usual source of care, but also in medical bills. While in 2023, 12% of Latinos reported problems paying medical bills compared to 8.7% of non-Latinos. And in also all other areas that not always receive the attention of researchers and media, for example, dental care. Only 61.5% of Latinos visited a dentist the past year compared to 74.7% of non-Latinos. And as we all know, dental care is an integral part of preventive care. And it has many other implications for human health, and we not always pay the attention it deserves. As well, the almanac contains many important findings in terms of health that I won't repeat here because they have already been highlighted. But one that is particularly worrisome is that Latinos have a higher prevalence of diabetes, but also that they experience higher hospitalization rates and mortality from diabetes. So that points to an area where we need to find solutions on how to prevent this from happening. And another a paradox that I also found is that in spite of Latinos experiencing higher rates of obesity, Latino households are also more likely to experience food insecurity. So it seems to be kind of paradoxical that at the same time you have higher obesity rates, but also higher rates of food insecurity. So that calls to not only have a focus of a health care provision perspective, but also from a social determinants of health perspective, where you find different ways of looking at health environments that impact the outcomes. For example, as we were mentioning here, access to sodas and other types of behaviors that have a direct effect on health. So with that, I will invite the next panelist to provide the highlights of this almanac.
Yes, thank you, Dr. Bustamante. And I'll just say, I appreciate that you called out dental. We wanted to include it in the slides today. We didn't have enough time, but there is slides on dental access and care in the almanac. And maybe I'll ask Mayra to provide your insights next, because I know dental and housing insecurity are issues near and dear to the Children's Partnership.
Yes, absolutely. Thank you, Diana, and thank you for the opportunity to join you today. I'll definitely follow up on Arturo's comments about social determinants of health and social drivers of health, because I think that's what really came alive in this almanac, really recognizing that Latina children and youth are facing higher rates of housing instability, food insecurity, adverse childhood events, and lower level of school readiness. That really speaks to the community conditions that we are raising our children in and how they contribute to our health status, in addition to healthcare access and healthcare coverage that we know is so important. But I also want to call out, attention to our opening comments from Jane Delgado, talking about just the environment around us at the national level, the political environment, and what that is how that is showing up in the health of our community today. And so really thinking about consideration for immigration status and how that impacts the health and well-being of young people, of children, of families, of birthing people, of mothers. So that really came out in this data, and I think really draws attention to the multiple factors that are considered in well-being, but also the multiple systems that have a role to play in ensuring that Latinos are as healthy as possible. I think the other just important data point that is almost something you can gloss over is the fact that we are 40% of the population in California. And really for a moment to sit with that, to really recognize that Latinos are California, that we are an incredible component of our community, of contributing to the economy, of the culture and vibrancy of this state, to again, these opening comments, and that children are more than half of all of our children, Latino children. And so really, I think just underscoring that and pausing in that moment is so important, again, in this political moment in front of us. And then the last thing I will say is, I think the data that comes alive in this almanac, I think also allows for questions to be asked. These questions are coming in, even in the Q&A that we're receiving, but also really wanting to dig deeper into what is happening behind these numbers. When we know that pregnant Latinas are more likely to be overweight or obese or have diabetes at delivery or stop breastfeeding earlier, is it because they don't want to, or does that raise questions around the job status that they have, their economic situation, and having to go back to work as soon as possible? So really allows us to delve deeper into these questions in order to identify what are the policy solutions that we can drive forward as a state to ensure that more of California, more Latinos are as healthy as possible. And the same goes with Arturo's comments about Latino children and this paradox of we're more likely to be food insecure, but also more likely to be obese. So that raises the question around access to nutritious foods and what that means for Latino families. So really appreciate the opportunity to comment and the discussion today.
Thank you, Mara. Sasia, anything you would add?
Thank you so much, and good afternoon. Thank you for having me. This is a day to celebrate. We talked earlier about the difficulties that our Latina and Indigenous communities are facing on a day-to-day basis with the social political context that we're in. And this work, this almanac, is truly transformational and visionary. We know that it takes intentional work with communities to be able to advance those health equity solutions that we're seeking. And I'll point us to our recommendations. Under the access to high quality healthcare recommendations, there are two specific ones: helping more Latina students become health professionals and increasing the availability of healthcare professionals that speak the patient's language. And I'll say, as we mentioned, Latinos make up 40% of the population. By 2050, we'll be 50% of the population. We make up 40% of the workforce. More than half of the children in California are Latina. Like Mayra said, we are California. And so when we are talking about the healthcare workforce, we are talking about Latinos. So how do we strengthen that pathway to ensure that our students can be successful? Thinking as young as a kindergartner who wishes to one day become a healthcare professional, a doctor per se. And at LCHC, something that we're doing, and I'm excited to share here with you all, is that we're partnering with amazing partners like CHCF, like Cal Wellness, like HealthNet, and other partners in the healthcare delivery field to advance a campaign to address the Latino physician shortage, more doctors for California. We will be rolling out externally starting October 1st on Latino Physician Day. But it is extremely important to look at the full pathway and look at the infrastructure in terms of policy changes and expansions and protections in the current context, right, that need to happen within the existing infrastructure that we know is supporting and advancing those solutions. Everything from embedding community colleges into the pathway to ensuring that our prime programs are protected, that GME is protected, all the way to retirement, right? The whole pathway as you become a physician. And ensuring that as our student, that pre-K child that is thinking, one day I would love to become a doctor, that they have the pathway and the steps that they can take advantage of to one day be that physician seeing us in the patient, in the doctor's office. So I think this need to not just address the acute needs right now, right? We're facing deportations, we're facing these acute fires, but keeping an eye on the future and knock on wood, 3.5 years from now, right? Our community will need to be lifted up from whatever reality we're in. And by us investing in these forward-looking solutions, we're ensuring that we do have a future and that we are strengthening our community as we move forward. I'll pause there.
Thank you, Cecia. And for the reminder to keep our eye on the prize, because there's a lot of gains we need to make on Latino health. That being said, crises are at hand, and I want to turn the conversation to talking about Medi-Cal. As we've already spoken about, over a third of Latinos in California rely on Medi-Cal for healthcare coverage. That's over 50% of all Medi-Cal enrollees. Given the cuts to Medi-Cal, what do you see as the most urgent priorities for strengthening Medi-Cal's impact to meet the needs of Latinos? Mayra, if you wouldn't mind taking the answer first, that'd be great.
Sure, absolutely. And it's such a great question, especially in this moment. And I think what the opening statistics really call attention to the fact that Medi-Cal is a critical program, not only for healthcare access, but for the economic well-being of families, right? The idea that you can go to the doctor and have coverage is absolutely critical for Latinos and for Californians more broadly, but also the peace of mind of being able to get the services that you need, right? Part of our mental health crisis is the anxiety and stress of not being able to pay our bills, of not being able to take our kids to the doctor when we need to. And so right now, in this moment of urgency, is really recognizing the power of Medi-Cal and how it contributes to the economic well-being of families more broadly. But another thing that really stood out in the almanac was that despite these coverage numbers, which we know are so important and we want to keep up, almost a third of Latinos reported not having a usual source of care, almost a third. And that really highlights that the complexity of our healthcare system continues to be a barrier to care for many families, and really thinking about what California has done to improve and address that complexity. And we've done a lot in California. We've moved forward important benefits in Medi-Cal to strengthen delivery of care for children and families. And we need to build on that and strengthen implementation of those benefits. One example one is community health workers and promotoras, which are a tremendous new benefit, I should say new in quotation marks because it's been a couple of years now, benefit that allows community health workers, promotoras, individuals with lived experience and expertise to help families navigate that healthcare system, help them adhere to their medication and their treatment plan with their provider. And yet that benefit has not rolled out as successfully as we would like, and we want to build on it and strengthen it moving forward. And organizations like ours, like Latino Coalition, and so many others that are here with us today are working to ensure that the department is strengthening implementation of that benefit. And it goes on. You have doulas, we have dyadic care, we have CalAIM initiatives to enhance care management, all of these incredible benefits to support and strengthen Medi-Cal and its delivery for children and families. And yet the translation of that to integrate community providers, to ensure that we are working with trusted resources in the community that can help break down those barriers to our traditional healthcare system. We've got more work to do. And I think to your point about this urgent moment and what we're seeing with Medi-Cal, we want to make it as strong as possible so that individuals recognize how critically important it is, and we all fight to keep it as strong as possible.
Thank you, Mayra. Would you say it means really resonates with me, and that coverage really isn't care, and we really need to meet Latinos where they are. Cecia, is there anything you would add about Medi-Cal?
Definitely. I'll say access to care. We know that Latina and Indigenous health was already fragile coming into this year. We have still remaining chilling effect from the first Trump presidency. We saw the pandemic take a lot of our community's lives, a lot of acute cases. We continue to see long COVID and acute cases in the community, and we're still recovering from the socioeconomic impact to our community. On top of that, we saw systemic disenrollments with the Medi-Cal unwinding. And we know that the current dismantling of our systems, both because of state budget difficulties and federal dismantling of our system, is going to affect access to care for Latina and Indigenous communities. And when we talk about the difficulties that we're facing, we also have to realize that as California, we have a huge opportunity in our hands right now. We actually have the power right now to assess what was working and what was not. Many times we think and we say, right, these systems that we're in weren't created by us or for us, and so we experience those disparities. Well, right now, California has in their hands the power to create the infrastructure, health infrastructure, to protect Californians regardless of who is sitting in the presidency. So we know that our legislators will have a lot of difficult decisions to make in the upcoming years, but part of that needs to be a way to think about revenue generating solutions, a way to create the infrastructure to protect Medi-Cal and our safety net programs in California.
Thank you, Ceci. I appreciate your comment on this being an opportunity to reimagine and fix a system that hasn't been working for many. Arturo, anything you'd add on Medi-Cal?
Sure, of course. I think that following up on Cecia's comments, I think that one of the first priority will be to make sure that the federal provisions like work requirements, higher cost sharing, or having to re-enroll twice a year don't push large numbers of adults out of coverage. The second one, we need to create programs that help foreign-born Latinos that are more likely to be uninsured according to the Almanac, and mixed status families stay connected to care. Right now, many are stepping away from the healthcare system because of immigration enforcement and fear, so we need to build bridges to keep them connected and engaged with care. And third would be to tackle ongoing and old medical challenges, like as Maida was mentioning. So we need to help people navigate the system better and ensure like strong follow-up care. This is especially urgent for chronic conditions like diabetes, which kills Latinos at nearly a 60% higher rate than non-Latinos. So there's definitely big challenges at a moment where resources are gonna be lower, like cut. So we need to address this in the upcoming 2 to 3 years when big decisions will have to be made.
Thank you, Arturo. I appreciate your point on focusing on the conditions that disproportionately impact Latinos. You'll see in our policy recommendations that is something that we recommend as well. So I know we've spoken a lot about different policy threats, including those to Medi-Cal. I'm excited to hear from the rest of from you all about what other threats to Latino healthcare access are you seeing right now in terms of policy, and what are the policies most effective to addressing these threats to care for Latino communities? Maybe I'll start with Maida. Do you want to kick us off?
Sure, happy to. So there are so many threats, right? I think this is such a scary time for our families on many different levels. And I want to also recognize it's an important time to appreciate the incredible power of culture and the incredible power of connection that the Latino community has time and time again had as an important protective factor, particularly for the well-being of children, for the well-being of pregnant women, right? This idea of Dr. Fernandez highlighting the very scary maternal mortality crisis that's increasing in Latina women really draws attention to this external environment and what's causing our pregnant women to be not well, despite decades of incredibly positive health for them. But one thing that I think is particularly impacting the well-being of children and families right now is this changing narrative around who takes care of our kids, who is the village that takes care of our children, and who is our child, right? At the Children's Partnership, we deeply believe that a child is a child and all children are our children. And as we see attacks on immigrant children, as we see attacks on LGBTQ and trans children in particular, that narrative about who is responsible for raising our children is changing, these culture wars that are happening. And I think it's important to double down on what we know to be true about the power of connection and community and what we can do to strengthen the experience of well-being for children and families in California and across the country. But California can certainly lead the way. And one of the recommendations that came out was really focusing on those early years of life that again, Latinos, children are more likely to be Latino. So supporting the well-being of those early years of life when 90% of the brain is developing, including in the womb for birthing people, for mothers, those preventive services. Again, the changing conversation around vaccines, the changing conversation on what Tylenol, how it impacts a pregnancy and how it doesn't. These are conversations that Latino to Latinos need to have with promotoras, with our healing circles, with providers that we trust. Again, really recognizing the importance of ensuring that that village of that's going to raise our children, it absolutely includes trusted healthcare providers, but it includes the promotoras, the comadres that are part of our community and that we are looking to for trusted information. So all of us have a role to play in helping not only raise healthier children, but ensure that our community as a whole is as strong as possible.
Thank you, Mara. Arturo, what would you add?
Well, I would add a couple of emerging risks. One is the fact that many Latino older adults might be getting old and not being eligible for Medicare because they are undocumented or they didn't contribute enough years to Medicare. So that's why Medicaid for undocumented immigrants is so important to keep alive and to keep funding this program in the long term, because many older adults are going to need it as they grow old. And then the second one, I think, would be the spread of mis and disinformation that will also be like impacting the needs that the community has in having the right recommendations when it comes to health. There's many different messages now with social media and other types of messaging that we're getting is becoming more confusing. So I think that's, as people who are dealing with how to provide adequate and evidence-based recommendations, we need to definitely find ways to communicate what is accurate so that Latinos take the right decisions in terms of their health.
Thank you, Arturo, for calling out that important piece. Cecia, anything you would add?
Yeah, I'll just add, we know what works. If we look at the perfect case study during the pandemic, right, we saw that when we strengthen relief policies that were directly supporting the health and safety net of our communities. So for example, Medicaid flexibility, expanded EITC, expanded child tax credit, housing vouchers, eviction prevention assistance. We actually saw that across the US, we lifted 12 million people out of poverty. But we also saw that as soon as those relief policies were cut off, we saw people going back into poverty. And so we have in our hands the power to strengthen that safety net, to strengthen that infrastructure, to ensure that our communities are well and protected. And, we've talked today about the difficulties and those health disparities increasing with all the difficulties we are facing. But our Latina and Indigenous community is resilient and powerful. Even through all those difficulties that we face in California, our Latino GDP is $1 trillion. If we were our own country, we would be the 8th largest economy in the world. And so when we talk about the theory of human capital, which says when you keep your population healthy, you keep your economy healthy, we're saying California needs to invest in Latino and Indigenous health in order to keep that economy healthy. So that when we say California is the 4th largest economy in the world, we're saying, well, the Latino community is powering that. And so we must ensure that our systems and our infrastructure around safety net and healthcare access are protected to protect the larger population and the state as a whole.
Thank you, Cecia, for that reminder to lift up what we know works. I'm going to shift us to some questions from our audience. The first question that I want to pose to our group is really around the emotional and mental health impact on Latinos right now, given the turbulent times we're experiencing. Specifically, I'm seeing a question about what do you recommend needs to be done to address the mental health and emotional impact for Latinos right now? How do we motivate the Latino community to receive medical care and to get their mental health needs met at this time?
I can get us started.
Please,
I don't think there's, I think it's an all hands on deck moment as far as trying to ensure that we're connecting with families. So again, we all have a role to play in thinking through how to connect families with trusted sources. We are incredibly fortunate to have a strong community health center network in California that predominantly Latinos are attending community health centers, right? They're more likely to attend one. And they are opening their doors to all, regardless of immigration status. And I think really highlights the need to have trusted community health centers and responding to this moment, especially. I think promotoras and supporting the role that they play in providing that bridge to our healthcare system, answering questions, being communicators of trusted information to Dr. Bustamante's comments about the misinformation that is out there. But I think also, at least for us, really recognizing the power and leadership of young people, particularly in the mental health crisis. We're very proud to be supporting Department of Healthcare Services in distributing grants for youth peer-to-peer programs in high schools across the state of California, really uplifting young people as peers in supporting their mental health of other high school students. Again, recognizing that it is that lived experience, even with young people, not just for adults, but even with young people, to ensure that there is a trusted someone to talk to connect with, to answer questions around. And especially when we know that 55% of K through 12 students are Latino, many of them from immigrant families. The issue of immigration is a child issue. The issue of immigration is a health issue and should be considered as such. So really thinking about the role of young people in this fight to push back and support mental health is something that we want to center in the work ahead.
Yeah, and
Go ahead, Arturo.
I would add that also from a finding of the almanac, there's not only a Latino physician crisis, but also a mental health professional crisis, as pointed out in this data source. So we need to invest in being able to create like the work for the psychologists, the psychiatrists who will be supporting this. Because it's not only about focusing on physicians, it's focusing about in all types of healthcare workforce where there is a deficit.
Thank you, Arturo. And that leads me to my next question that maybe Cecia, I'll let you take, which is, can you speak to some of the barriers and solution to improving the physician workforce disparities that were commented on in the almanac?
Yeah, of course. So, and if I can just quickly add on the mental health note, I think it's time as well to just acknowledge the deeply distressful situation that we're in, and that for many of us, because this is our passion and our work, we're facing a moral injury on a day-to-day basis, and we have to, get up every day, know that it's affecting our personal life, our family, our loved ones, and continue fighting. And so sending all of you on this call today encouragement. We need you in the long run. Please take care of yourself. If you have staff members who are Latino or Indigenous, please, take care of them as well. And together we can continue supporting each other's mental health. On the pathway, as I mentioned earlier, there are specific programs, and as part of our policy agenda with the More Doctors for California work, we are looking at programs that work. How do we continue to protect right now, given the difficulties with the budget? But ultimately, how do we expand these programs that work, such as the Prime program, such as GME opportunities, such as the community college pathways that exist to connect our Latina students into the career. And so as we continue to move forward, depending on where we're at and what level of influence we have the privilege to hold, right? Continuing to center those opportunities, continuing to open up doors, and to the degree that we can, advocate to ensure that those systems are protected and strengthened.
Thank you, Cecia. I really appreciate your comment on the reminder to be there for one another right now. So thank you for saying that. So we are just about ready to wrap up. I want to thank all of our speakers. In particular, I want to thank our panelists for sharing your insights and expertise today, and to everyone in the audience for joining us and engaging in this important conversation. Before we close, we kindly ask that you take a moment to complete the brief survey that will launch when you exit the webinar. Your feedback is really invaluable in helping us to shape future content. With that, thank you again for being with us. We appreciate your time, your commitment to advancing Latino health. Take care and happy Hispanic Heritage Month.